Everyone, last session we have seen threatened inevitable miscarriage. So now we'll see complete and incomplete abortions or miscarriage. In that we are going to see definition, clinical features, complications, management. Definition of complete miscarriage. The name, remember, complete miscarriage. When the products of conception are expelled out, it is called as complete abortion. In uterine cavity, all the conceptual material came out through vagina, expelled out. That is called as complete abortion. Clinical features. So here, इसमें क्या हुआ, पूरा conceptual material, fetus parts सारे बाहर आ गए. Now she is not pregnant. So that means completely miscarriage. Complete products have been came out. So here subsidence of abdominal pain. There is no abdominal pain because all the material came out and we cannot see abdominal pain. Vaginal bleeding becomes trace or absent. Vaginal bleeding because all the conceptual material, पूरा material बाहर आ गया है. So there will be no bleeding. Internal examination reveals uterus smaller than the period of amenorrhea. So most of the students have doubts of this. Uterus smaller than the period of amenorrhea. Suppose in 24th week, the abdomen, uterus have to grow till umbilicus. That means this is fundus. So that mother is in 24th week. Now she has complete abortion. So what happened? All the material has been come out. So now you can see if internal examination is doing, but we cannot found fundal area. It may come to a less. Pregnancy is 24th week, but when we check, fundal area is below umbilicus. That means uterus is smaller than the period of amenorrhea. So when internal examination done, then we can feel here in complete abortion, uterus smaller than the period of amenorrhea and cervical os is closed. Then ultrasound reveals empty uterine cavity. Nothing is there in the cavity. When we do, no conceptual material, no fetus. So these are the clinical features. Next we will see management. So here completely all the conceptual material has been came out, expelled out in complete miscarriage. So especially in Rh negative patient without antibodies in her system should be protected by anti-D gamma globulin, that is 50 to 100 microgram intramuscularly should be given. So in early or late miscarriage within 72 hours can be given. So before 12 week of gestation where no instrumentation has been done, so this anti-D gamma globulin is not required. That means before 12th week it is not required. So that is for only Rh negative patients. Next we will see incomplete abortion or incomplete miscarriage. So I'll give an example here. So this is a threatened abortion, this is inevitable, and this is incomplete. So in threatened, what happened? Baby is inside and placenta, this is placenta, you can see. So bleeding has started here, but taking medicine which has prescribed by the gynecologist, the pregnancy can be continued. So if it is not treated or it has been progressed, bleeding has been progressed and baby's conceptual material also coming out, increased vaginal bleeding and severe abdominal lower abdominal pain where the conceptual material came out, amniotic fluid. So in this, pregnancy is impossible. Here we can continue the pregnancy, here can't continue because all the conceptual material has been started to a state where continuation of pregnancy is impossible. Next, it is a incomplete. Incomplete, what happened? All the material came out. In incomplete, so conceptual material came out, but there are tissues inside. Like when the entire products of conception are not expelled, instead a part of it is left inside. थोड़े पार्ट्स अंदर रह गए हैं, थोड़े टिश्यूज अंदर रह गए हैं, पूरे पार्ट्स आ गए हैं कंसेप्चुअल मटेरियल के, बट थोड़े टिश्यूज. it should be inside, it will be inside. So what happened? Infection may occur, so pain may start. So this is called as incomplete. Threatened, inevitable, incomplete. So next we will see complete. We have seen. So in complete there is no specific treatment because all the conceptual material came out. If any bleeding is there, that might be controlled by giving methergine. And blood loss, if there is any blood loss, IV infusion can be given. So blood transfusion also can be done. Next we will see incomplete. So in incomplete, what happened here? When the entire products of conceptions are not expelled out, instead a part left inside in the uterine cavity is called incomplete abortion. As I said, conceptual material is came out, but there are certain tissues inside, so that is called as incomplete abortion. Clinical features: continuation of pain in the lower abdomen because some tissues are inside, persistence of vaginal bleeding, and internal examination reveals uterus smaller than the period of amenorrhea, as I said before, and patulous cervical os, that means widening of the cervix can be seen when admitting tip of the finger inside. Next, varying amount of bleeding and also expelled mass is incomplete. So what has been expelled in threatened abortion? I said you that as a nurse you need to preserve the pads, we need to find out the tissues if any conceptual materials came out, pads पे check करना है. तो incomplete expelled है मतलब there are something inside the uterus. Next, complication. If this is not treated, profuse bleeding can occur with some tissue parts, sepsis also can occur, and placental polyps. Next, management of incomplete abortion, early abortion and late abortion. So in early abortion, dilatation and evacuation can be done, and manual vacuum aspiration. So this we are going to learn in next sessions. What are all these methods? How dilatation and curettage evacuation should be done, what is manual vacuum aspiration. In late abortion, uterus evacuation done under general anesthesia, removed material. So this uterus evacuation, that means they will be removing or emptying all the uterine cavity. So when they empty the uterine cavity, so our removed material, that removed material or conceptual material should be sent to the histological examination. Next, medical management. Here misoprostol should be given, that is 200 microgram is given vaginally, that is every 4 hours. So this is a tablet misoprostol, that is 200 microgram. Okay, complications will be less when we are comparing to medical methods. Next, here as I said that this is threatened, this is inevitable, here are the incomplete abortion. So if you have any kinds of doubt, you can message me. So here we have seen complete and incomplete abortion. Here we will have quick summary. Complete is when the products of conception are expelled out, completely expelled, that is complete miscarriage. Incomplete, when the entire products of conception are not expelled out, instead a part is inside, left inside the uterus, that is called as incomplete abortion. Hope you have understood. Thank you.